Hi, it's Kellye Jones, your co host of the Moving Forward podcast. We bring powerful conversations with people who have faced misdiagnosis, and overgeneralized diagnosis. And guess what? They came out stronger. Each guest shares how self awareness became the turning point that saved their life and gave them hope for the new future. In the US alone, there are 7 to 12 million cases of misdiagnosis every year. And sadly, 40,000 to 80,000 of those cases end in death. Our mission is to shine light on these stories, raise awareness, and empower others to speak up, trust their instincts, and take charge of their health. Today's guest, well, I actually have been blessed with two guests, but we're going to start off with the first one, and it is Shafika Miles. Shafika Miles is a two-time open heart surgery survivor. Her journey began with an atrial septal defect, or ASD, a hole in the wall that separates the heart's two upper chambers, the atria. When the hole is small, often less than 5 millimeters, it can easily go unnoticed. Infants are always automatically screened for infants are not always automatically screened for ASD, even though a simple non-invasive test called a pulmonary oximetry can detect low blood levels. While genetics can sometimes play a role, most ASD happens sporadically. The condition can even be detected during pregnancy, but too often is missed. That's why so many people with ASD are misdiagnosed, confused for asthma, bronchitis, pneumonia, or even stroke because of overlapping symptoms, imaging challenges, and the tiny size of the defect. Shafika's story is not only about survival, but about resilience, misdiagnosis, and the courage to face heart surgery twice. Her journey reminds us why awareness and advocacy matter. Stay tuned as we share her powerful testimony of strength, faith, and perseverance. How are you today, Shafika?
I'm doing fine. How are you? First of all, thank you for having us here. This is a blessing to be able to tell our story here. So,
Yes.
yes.
And so I want to mention also that sometimes in life we have a true Florence Nightingale, somebody who helps us along the way. So we also have um, sh- sh- uh, sh-
Dr. Florence Champagne.
okay, Dr. Florence Champagne here with us. So she's going to also share her story of survival and faith. So I wanted to ask you,
Okay.
because you do have an amazing smile, just as other people say,
Thank you.
what do you think gave you that smile, gave you that strength, gave you that resilience?
Just from what God has brought me through, I mean, two open heart surgeries. A person walking around like that is just, to me, every morning I get up and smile because it did not have to be that way. And God basically saved my life not once, but twice here. So I have a testimony as far as to share with everybody to help them out.
Before the open heart surgery, was there something there to help you get through that process, or as you received the diagnosis or found out about it?
Yes, I have a very strong family. In fact, my mother, she is the first African American female pharmacist in Springfield, Massachusetts. So she has been in the medical field for a while. So having her by my side, having her help me ask the doctors the right questions, and her asking the doctors the right questions really helped me through. And my sister is a breast cancer survivor. My brother was a heart disease. He had heart disease, but unfortunately he passed away. So I did have a strong family unit of everyone supporting each other.
I just want to go back 1 second.
Okay.
Your mother
Yes.
that you mentioned earlier,
Yes.
did she belong to a sorority?
Yes. My mother is belonged to the Delta sorority here.
Delta Sigma Theta
Yes,
Sorority
yes,
Incorporated?
yes.
Okay,
Yes,
just
she did.
checking.
When
Just
She was
checking.
in New England College of Pharmacy here. Yes, she did.
I love
So,
it. I
yes,
love it. So
yes,
everything was going well.
yes,
Life was fine. Life was normal until March.
yes. March of '92. Just a regular day. Worked a full day. Came home. I was a single parent. My daughter was 5 years old at the time. So I came home and I went downstairs in the basement just to get a good workout in. And when I came upstairs, I started having pains in my chest and shortness of breath. And it was like, hey, this is not from working out. This is something different. So I did something that I tell everybody not to do. Was drove myself to the hospital. Didn't tell anybody.
That's what I mean. Strong woman.
I took my daughter, next door and just went to the hospital because I thought I was just going to be checked out and they were going to send me back home in time to get my daughter ready for bed the next morning. But that did not happen. I was admitted and had to have emergency surgery.
Wow. Did you have any symptoms beforehand, like anything to make you think that this was gonna?
No, I did not. And I was very active, and everything. And stuff,
so you wouldn't look like the quote unquote typical patient who would have two open heart surgeries.
Yeah, exactly. Yeah. But I just, to me, it was something. There's, big discernment that we have. We know our bodies the best, and to be ordered to just say that, okay, that wasn't for me just coming up from working out right now. There was something that felt totally different, and to get immediate help because as women, so many of us put that off, and they don't say anything to anybody. They say, okay, I could have said, well, I've got to get my daughter up for school next day and for work.
Yes.
So I'm going to get this checked out, tomorrow or at the end of the week here and stuff. But, something that I felt that had to be checked out right away.
So self-awareness help with your likes, your dislikes, and your limitations.
Yes.
As far as what was going to come next.
Definitely. Yes.
Well, do you have a similar story, Florence?
Well, my story is a little bit different from hers as far as what happened to me. I would go back and forth to the ER for almost a year. So I was suffering all that time. I never really felt a big crushing chest pain, but I just would feel some discomfort, some jaw and neck pain, and then some lower back pain. But I knew that I was having problems breathing. So I went back and forth to the ER for almost a year. I was told at one point I had unstable angina. So I was satisfied with having some type of diagnosis. So I was walking around saying, well, this is what I have. I have an unstable angina. Every time I get a pain, I'm supposed to take one of these pills, a nitroglycerin tablet. It wasn't until I collapsed and
Wait, you collapsed. Wait, what were you doing when you
I
collapsed?
I was just walking. And when I was walking into a building, it felt like I was climbing a mountain. It was so hard for me to walk. My oxygen was literally being cut off. And when I got to the door of the building, I just prayed that I could open the door because it was a big glass door because I had no strength at all. And then when I got inside the building, I did collapse. But I pretended, I'm so crazy. I pretended that I was on the floor looking for something. And someone came by and said, ma'am, are you all right? I said, yes. I was embarrassed. But I remember I had met a cardiologist and I had his telephone number in my pocket. And I called him on my cell phone. And he said, go to the nearest ER. I said, I'm not going back there because the last time I was at the ER, they told me to seek counseling as if the pain was all in my head. So I did not want to go back to the ER. And he guided me to a colleague of his, another cardiologist in that area. And they did what they call a cardiac catheterization. That's when they inject dye in your system to see if there's any blockage. They found out that my main artery was 99.9% blocked. And they were rushing me off to the operating room to perform emergency open heart surgery. But then I found out, and I thank God for sparing my life, and I found out that my story was not unique, that we are often misdiagnosed. Another thing that he told me was that it was because I didn't have insurance at the time that I did not receive the proper diagnostic treatment.
Wow.
So I became angry, and then I became an advocate to say this should not happen to anyone. And then I started the Open My Heart Foundation. I was approached to become Women Heart Champion. It's a national coalition of women that supports women with heart disease because oftentimes symptoms are different for women as opposed to men. So our symptoms may be a little bit more vague and harder to diagnose, and the doctors may or may not know what to look for. And especially in African American women, we're not a part of clinical trials and all of that. So,
Do you know why sometimes it's harder to diagnose African Americans?
well, there's a lot of research that was done on that, and pain is not seen in African Americans the same way that pain is seen in white males.
I'm gonna give
So
you
we're
something
not a
else. Are
part.
you ready for something
Uh-huh.
objective? So I was in 19 in the 1990s. Um, I'm sorry, 1980s. They did the they that was when they came up with the oximeter, right, to determine the blood oxidation level. And a lot of times with these tests, the first thing they'll do is they'll check with the blood oxidation with a pulse ox, or they'll test with the blood pressure cuff. Well, guess what? Have you ever heard don't wear dark nail polish when you're getting that test?
Oh,
Because what happens is when you have dark nail polish, dark skin, burns, tattoos, it gives a false positive, false positive um, oxidation level, meaning like it looks like your oxidation is where it should be,
Right.
but it is not. And that is for melanated skin that there's been a tougher challenge. So I just want to read this really quickly. With regards to atrial fibrillation with African Americans, there's a lower prevalence than other nationalities, but also there's worse outcomes, higher rates of stroke, heart failure, mortality, worse outcomes for Black infants. In 1921, I'm sorry, in 19, I don't know if it was 1921. I think it was earlier than that, but British Health Prime Minister, I think that was 1980, Sajid Javid announced shortly after, yeah, it was 1980, announced shortly after the oximeters introduced that they noticed it produced false positive results in Blacks. In 1990, a study found that the pulse oximeters were less reliable in Black patients and recommended that manufacturers test their devices on diverse populations. The study discovered that Black patients were more than twice as likely to have an inaccurate reading compared to white patients. And once again, there were more studies in 1921, in 2021, the medical library from the National Institute Medical Library, they actually once again brought up the subject again. So what was happening during COVID is that a lot of African Americans were going to the clinicians stating that, I think I have COVID, I'm having these heart palpitations, I can't breathe, blah, 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 blah. But they were being sent back saying, oh no, you're okay, you're okay, you're okay. Well, when all these cases started to happen, the doctors were like, oh man, because African Americans were dying at a higher rate. They were like, oh my gosh, they're going to hold us accountable. They're going to sue us for these. And that was when people started to reveal, oh, wait a minute, back in 1990. Oh, wait a minute, back in 1980. So this has been going on for a long period of time.
Of
so
course,
if you went to the doctors, they might send you back saying you're okay, not to the fault of the doctors, because they did not know necessarily about the faultiness of the equipment.
Right. And to add to that, even women in general, whether Black or white, we are often misdiagnosed with heart disease or cardiovascular disease. We're not properly diagnosed because our symptoms are different in general.
How are they different?
Feeling nauseous, for example, is a symptom that something could be going on with your heart.
Wow.
I was on a show one time with Rosie O'Donnell, and that's what her symptom was. Just had a nauseous feeling, but she was in fact having a heart attack. Lower
did they
back
think she was
pain.
pregnant?
I don't think pregnancy came up, but this is often a misdiagnosis of, and now it is stated, that these are some of the missed symptoms that women have that doctors may or may not pick up on. The nausea, lower back pain is also a symptom that something could be going on with your heart. A jaw and neck pain is a symptom that in women in general across the board. So we're hearing this now. I've been on several panels with doctors and researchers and things like that. So we're finding that the symptoms are a little bit more vague with women as opposed to men. And so it's out there. The information is out there, but we know our bodies, and you know we know when something is wrong with our bodies. But we as women, we are the bearers of pain. I mean, we bear children. You know, we bear a lot. So I think we mask our pain very well. So when I would go to the doctors, for example, I was told, "You look fine." And I could look like this and saying something is not right. I'm not a white male. I'm not turning red. I'm not obese. You know, so what do they have to go on? What your appearance is, which is wrong when I'm stating, no, something is not right.
And that's where I think that there needs to be a clear definition with, you know, that pain scale,
Exactly.
1 to 10,
Mhm.
because my one
Mhm.
or my one may look like a 7.
Yes. Okay.
So
And
once again, just
sometimes-
helping people to understand, because once again, as women, you know what? As you said, we bear the brunt.
Exactly.
Things got to get done.
Yeah, exactly.
And if we don't do it, a
Mhm.
lot of times they don't get done.
Yeah.
So
And
what do we do?
sometimes- Yeah, and sometimes there's just no symptoms, you know, because I did not have any symptoms here. And when I had my surgery, come to find out, I had a hole. I had a hole in my heart, and I never knew it. They couldn't tell me whether I was born with it or not. And I went to the same thing when I first went to the emergency. From there, I had a cardiac catheterization and then surgery after that. But by the time I had my surgery, they told me that the hole was the size of a silver dollar and hardly any blood was getting to the rest of my body. That's why I had to have emergency surgery at that time.
Do you know how many
So-
centimeters that was?
No,
Or millimeters?
I don't.
Okay.
No, I don't here. But it's just, you know, as Florence was says, you know, the symptoms vary so much if you have any symptoms at all. And I was very, you know, active growing up in sports and everything else, and did not have any symptoms during that time here.
And can I just say that
if it's
I'm sorry, insurance also plays a part. And
Mhm.
so some of the diagnostic tests are more expensive than others.
Yes.
Like we both mentioned cardiac catheterization.
Mhm.
That is a very expensive procedure to have. So
Yes.
that's not going to be offered to you. But that really tells the story of
Mhm.
what is going on with your heart.
Yes.
I've had EKGs, stress tests, cardio echoes, everything, but the cardiac catheterization, which is one of the most expensive diagnostic tests, uh, is something that is not going to be offered to
Yeah.
you.
so how do you
and it's one of
advocate
the
for
best.
that?
One of the best
Are you
tests, yeah.
advocating for that? Do you
Mhm.
have
So I really did not even know the term cardiac catheterization
Mhm.
until my cardiologist. He knew it. It's hard to advocate for something that you don't know anything about.
Exactly. Yeah.
But he knew that from looking at all of the records of my history of going back and forth to the doctors and the ER and seeing all of these tests, he knew what I needed. He
Mhm.
knew,
Yeah, mine
but he
too.
knew that insurance was the factor
Mhm.
because I couldn't afford that type of diagnostic test.
Mhm.
But he was the one person that was my advocate that was willing to take a chance on me without any insurance.
Mhm.
He said, "Don't worry, we'll get it done."
Mhm.
I love it.
Yes.
Mhm.
Love it. It's amazing. So when you have that guardian angel, and when you have someone who knows, right, versus
Mhm.
someone who doesn't know,
Mhm.
Yes.
because some clinicians, even though they don't know,
Mhm.
they may not tell you they don't know,
Yes.
right? So if they don't know and they're not telling you they don't know, or they're telling you that there's other options, sometimes
Yes.
you run into a standstill
Exactly.
as to how to move forward,
Mhm.
right?
Exactly.
And
Yes.
I do think race plays a part. I
Mhm.
listened to a cardiologist on a panel one time talked about how she did have a patient, and she talked to the surgeon about cathing her patient, doing the catheterization, because she had elevated levels of, I think they call it STD. She was literally having a heart attack before their
Oh my
eyes.
God.
Mhm.
And the surgeon said, send her to her primary care physician.
Mhm.
And she advocated for that patient, saying, no, she's right here right now.
Mhm.
We need to cath her
Mhm.
right now.
Mhm.
And the doctor turned her down again. And then she said, I'm sorry, but I don't want this to become another statistic when your bias is preventing someone from being saved. And she advocated for that person. And the doctor said, "Are you calling me a racist?" She said, "Well, they ended up saving her life because that doctor knew that she was being biased against the system and that she could have been saved right then and there. But oftentimes you're told or referred to your primary care physician when they don't take the next steps.
From there. Yes.
Is there an opportunity? So when I was talking about advocacy, is there an opportunity for like a bill or legislation or something like that to ensure?
We're so glad you asked.
Yes, I'm so glad you
How can we
asked that
support it,
question.
right? How can we?
So, my main thing was if heart disease is the leading cause of death, why aren't we being screened for it? Just like we're being screened for breast cancer screenings or prostate screenings. So a legislator heard me and wanted
Which
to know
legislator?
in the state of Maryland.
Okay.
Our name is Delegate Jamila Woods.
Okay.
And she said, "What can we do about that?" So we got together. I have some doctors on my team. And she, along with her colleagues, drafted legislation
Love
that to make it mandatory to have, they call it a calcium score test, which determines the amount of calcium buildup in your arteries for early detection of heart disease. So we advocated for that for 2 years, and it just passed May of 2025
Yes.
in both the
Yes.
House and the Senate. It's called HB 666 and SB 60. So we cross filed it in the House and Senate. So it overwhelmingly, unanimously passed. And
Yes.
so now in the state of Maryland, insurance providers are mandated to pay for calcium score testing as a part of our efforts.
So listen, if you don't live in Maryland, it's time to pack up and move. If you starting to have some shortness of breath, if you collapse while walking in the building, you need to move to Maryland.
But actually, we're going on a federal level. I've been
I love
approached
it.
so
Love
many
it.
times
Yes,
to ask, how can we get this bill
In every
passed in our
state.
state?
Yeah.
Are you
So-
looking at Dear Colleague letters? Have you started that process?
Yes, I did. We had a process started when we first wrote to the House of Delegates, and so it's a matter. It's a process getting other organizations on board. We have the Association of Black Cardiologists, Women Heart. We have different organizations, the Maryland Health Department, um, to write favorable letters as far as sponsoring us and helping us along with our efforts.
So if someone wanted to get involved or support you in any kind of way, how could they do that?
They can go to the openmyheartfoundation.org. Openmyheartfoundation.org.
Okay. And if they go to Open Heart Foundation, there's information on how to get involved or how to support?
Yes. They can submit an email to us. There's a comment section that goes directly to me. I get a lot of heart stories. Quite frankly, we honor heart and stroke survivors every year. So they write to me. I get letters and correspondence from all over the country, actually. People that find out about our advocacy and they want to know how can we help them. I get calls from the Philippines and different countries because
Wow,
people
wow.
need help. This one lady, her father needed open heart surgery. They couldn't afford it. So we just look for ways to help people in other countries as well as locally in the United States as well.
So as you're helping people are helping you.
Yes.
So it's all about supporting one another and the network
Amen.
and the build up and etc. And so with that process, is there another way that people can find out more about your organization, what you're doing? Hint, hint, look at the table.
Well, the book. So we have. I have a couple of books out now, but this is our latest one.
Okay.
Our Scars Matter, because just like Shafika's story, there's so many other women that have powerful stories of misdiagnosis, not being listened to. Not only that, the family history, the level of stress you go through with this. And so these stories help to save lives because people could relate to what you're saying and what we're going through, and then they could approach things a little bit differently, like how to advocate for yourself. For example, by saying, is there another test that you can give me that may tell what's going on with my heart, or could this be heart related? Once you say the word heart, I mean, that just is a red flag when you go to a doctor's office. Or, let's say you don't know about a cardiac catheterization. By saying, is there another type of test that you can give me? That's advocating, is pushing the doctors. And we want to work in collaboration with doctors. So it's like pushing the doctors a little bit further by them thinking of, they can't say, no, there's no other test. There's a lot of different tests that they could give you. But you kind of have to know that there may be something else going on with my heart. Know your family history, for example. And so they also have to justify why they're giving you these type of tests and screening.
Those insurance codes.
Yeah.
Yes, exactly.
So they have to
That comes
justify,
with a big tag.
and so you can say, well, it runs in my family. That's a justification. When you have high blood pressure, diabetes, obesity, and high cholesterol, those are all risk factors. So those are enough reasons why they can justify giving you a diagnostic test.
I want to say also that I can't remember if it's 54 or 64, but the average age of physicians is over 50, right? For the average physicians over 50. And so that means if it's over 50, they've been doing this practice for quite some time, right? And they probably have colleagues, if they reach a challenge, they might be going to a colleague who's been doing it for quite some time. And some of the things that you're saying, they just may not be aware of, So would it be good, this is kind of lead in, would it be good to even ask a clinician, do you know of other alternatives, right? Are you stuck at this point? If you're stuck, can you recommend someone else who might know more, or can you recommend a different type of clinician? Because a part of self-awareness and self-advocacy is also knowing when you've reached a limit.
Yes, exactly.
Right?
Yes,
exactly.
It's knowing all the options that are out there for you here. Because I know, the Open My Heart Foundation just does so much in making people aware of what's out there here. I know when, my first heart surgery, I was only 32. So I was scared to death because I didn't know anybody my age who has gone through, I thought open heart surgery was an older
person.
Older person, problem or everything. So that was, something. And then being a single parent at the same time and just being, scared to death as far as, okay, what's going to happen to myself or my daughter if anything happens here. So,
and I'm not sure if I mentioned it, but there are infants that are born with this. It can actually be detected neonatal. It can be detected in a mother who's pregnant.
Right.
Yes.
And,
congenital heart disease.
Yes.
And sometimes those openings are less than 5 milliliters, millimeters. So what happens is clinicians may look at it and say, hey, look, you know what, this is going to heal up on its own. Like 80% of them supposedly heal on their own. So they may not even mention it to a parent along the way, or that, some of that information may not be shared for people to follow up on it, right? To track the progress, or So with that being said, even as you become more self-aware, asking the clinicians, are you seeing something different? Is there something else I need to check out? Because sometimes we don't ask those questions. We just say, okay, you know what? I got to keep going. So I like the way your book, this conversation, is opening those doors for people to ask more questions.
Amen.
And then the book also too is it's not just an inspiring read, but it's a journal as well. Because after each chapter, you're asked questions.
I love it.
So you can journal that makes you think back. Okay, have I ever experienced anything like this? So each question is different after each chapter, and it's a different take from the 5 different authors. So you can have your own journal that you can write and look back on and everything. So
I love it, because you know what, that also gives you a baseline. So when things are going awry, you can say to the doctor, this is my baseline and this is where I am now. And something's not right. We're regressing instead of progressing. And so I read an article. It's like 56% of medical errors are due to gaps in medical history.
Yes.
So if the clinician is not aware of your past
Mhm.
experience,
Yes.
then it's harder for them to give you the
Mhm.
right
Yes.
test,
Yeah.
to
Very
secure the right
Exactly.
insurance codes, because
Yes.
the insurance codes are everything.
Yes.
They might contact the insurance company, but they might say you don't have enough information to validate us paying for this particular
Okay.
procedure. But I just want to
Okay.
say thank you so much for this amazing information and insight. And can you hold up your book one more
Thank you
time?
so,
Okay.
And
thank
tell
you
us
so
your-
much for having
Thank you
us.
for
and
having
can you
us,
tell
yeah.
us the website once again to make sure that listeners are able to find you?
openmyheartfoundation.org. And how would they find you,
Okay,
Shafika?
they can find me. I can give you my phone number. It's 240-513-8823, and you can contact me as well.
All right. It's Kellye Jones signing off
Okay.
for the Moving Forward podcast, Stories of Triumph. Thank you for everything.
Thank you.